Hello everyone. Today in our series of Docplexus KOL interviews, we have with us renowned reconstructive plastic surgeon Padmashree Dr. Ashok Gupta.
Good afternoon to everyone. It's my pleasure to be interacting with all of you.
I'd just like to introduce Dr. Ashok to you. Dr. Ashok is a highly accomplished surgeon and holder of many degrees and fellowships in the field of plastic surgery, aesthetic plastic surgery, microsurgery and laser surgery. He has more than 25 years of experience in this field. He has brought laurels to the country on the scientific fronts as well. He has also represented India for 8 years as the National Secretary for India at International Society of Aesthetic Plastic Surgery. Thank you so much, sir, for joining us.
Welcome. Thank you very much.
So many people are choosing to have facial plastic surgery to look younger and more attractive. Is there any procedure that is more popular than the others?
Many people are not resorting to look beautiful because no plastic surgery can ever create beauty. Beauty is inborn, beauty is hidden. What we can do is probably sharpen some of the features and remove some of the obstacles which are hampering the beauty. And also the part of plastic surgery which is involving the enhancement of beauty is only 1/10 part of the real plastic surgery. The real reconstructive plastic surgery is a major issue, which is a major contribution which country like India, people are accessing to plastic surgery, is accident, burns, birth defects like cleft lip and palate, variety of craniofacial deformities like hydrocephalus, etc. So this is very important part of the surgical field is a reconstructive plastic surgery.
Can you describe your philosophy on beauty regarding plastic surgery and identity?
Take you back about 30 years of my journey in aesthetic plastic surgery. To begin with, we have to undergo training in general surgery. There is no concept of beauty. General surgery, now I can term general surgery as a better than sort of a butchering because we don't pay attention to what patients are seeing, what scars are visible. Our theme was only to finish surgery, come out as early as possible and rest. But as I had moved into plastic surgery training, we have learned how to do a proper tissue handling, a gentleness in their approach, and to make sure that whatever is visible to the patient, including scar and the type of location of scar, is hidden in such a way that the patient cannot see all that. So that is the beauty aspect of the surgery. So in fundamental, if you say, the fundamental principle of surgery are applied more rigidly in plastic surgery compared to any other aspect of general surgery or orthopedic surgery. Now coming to the beauty aspect, over a period of time with the change of atmosphere, change of access and the media, etc., more and more people have become aware of what is visibly good and what is visibly not so good. With the celebrity status, some of the young girls and beautiful girls have acquired, and their endorsement that yes, people can achieve this similar type of features has helped through help of plastic surgery has really gained popularity in India in last 30 years time. I remember one of my celebrity patient commented, what God has not given to me, my doctor has given to me. So it has come a long way. It took time for the confidence building. It took time for the reaching to the level of fineness and to the level of least complication. But we are at a stage where we can offer a reasonably good result.
So can you please elaborate further on the reconstructive aspect of plastic surgery, because as you mentioned, it's more important than the aesthetic aspect.
If you look back 5,000 years back, the Sushruta, who is considered as a father of modern surgery or modern plastic surgery, used to practice plastic surgery in those days. He had full knowledge how to do a nose reconstruction, how to do a cancer reconstruction, etc. So from those days, the reconstructive surgery has really was the main bread and butter for all surgeons. In early days, when this plastic surgery specialty was not there, many general surgeons used to treat burns, many orthopedic surgeons used to treat hand injuries, and many of the pediatric surgeons or other surgeons used to treat the congenital deformity like cleft lip and palate. In last 50 to 70 years, since this specialty has grown after the Second World War, more and more life-altering surgeries have been contributed by reconstructive plastic surgery. I can share two of my cases which I shared are the big challenges. They have also the maximum number of free flaps is a world record. In one single patient, they have 7 major free flaps, and that is possible because I always say the key word in reconstructive plastic surgery is to be able to see through the invisible is the key to success. Because when we get badly mutilated faces and badly mingled body part, missing body part, and thanks to our oncosurgeon, they have removed practically 1/3 of the face and they have left us to reconstruct. Then it comes to be able to see from where to bring the tissue, from where to bring function, and from where to gain the confidence of the patient. And that is where the reconstructive surgery is tremendously helping the surgical faculty.
Plastic surgery comes with two types of risk, namely the anticipation of the patient and the real medical risk. So how do you minimize these risks and how do you judge the patient's anticipation?
This is a very crucial point because many people come to a plastic surgeon hoping that all their miseries and all their other issues will be taken care of by getting their nose fixed or getting their eyes fixed, which is not really true. And it is very important. A surgeon must assess patient in 3 aspects. What is the underlying cause why he is seeking a corrective surgery? What is the level of other issues in his professional life or personal life or social life? And what are the limitations of surgery which he can offer? I can share 2 examples. One of the young boy came to me about 20 years back. He came to me and he said he wanted me to create a big scar on the forehead. And he was a good young boy, good-looking boy. I said, "Why do you want?" He said, "No, okay, don't bother do that, but you create my eyes bigger, make eyes look very big and angry look." I said, "Why do you need? It is possible for me to make the eye small, but to make the eye big and is very difficult." And I said, "Okay, I can do it, but bring your parent. Without the parent consent, we cannot do surgery." When mother came and she started narrating story that he was a very brilliant boy who got admission to engineering college, and because he was being ranked in the college, he literally dropped out from the college, and he wanted to give an angry look on the face. That's what he was looking at, those sort of surgery and a scar. And if I have fallen in the trap of doing that, it would have been total failure, because by no means the psychological trauma and the physical weakness which he had because of ragging cannot be corrected by plastic surgery. It's very, very important for a surgeon to make his own assessment.
Recently, a news on the 24-hour-long surgery on conjoined twins had gained attention because of the enormity of the 3-phase project being conducted by AIIMS doctors for the first time in India. So considering this, can you highlight about the ethical dilemmas involved in performing plastic surgery?
I would not call it a heroism, but I call it a courage by a surgical field. The first kidney transplant was done by a plastic surgeon. That was in early 50s. First hand transplant was done by a plastic surgeon from Australia. He moved to France and stayed there for 2 months or 3 months and then performed surgery. The patient was from New Zealand, the surgeon was from Australia, the place was France. So these sort of things, that is how the surgery progresses. But the ethical issues involved in this, as long as it is not confirmed more than an experimental surgery, and as long as the surgical team is capable of taking care for all the final stages, including these educational and physical rehabilitation of the victims. I personally feel that institution and such type of surgery should be not taken on a experimental basis. There are several issues like this, an ethical issue also. Like world over, people are doing face transplant, people are doing hand transplant. The first case which I told you, that was a commercial success because the person who underwent hand transplant made a lot of money. The surgical team made a lot of money, but eventually it had to be taken off because there was a rejection phenomenon. Same thing also applies to several patients who are either undergoing face transplant or undergoing heart transplant. Unless the institution can assure that the immune therapy they can maintain for 10 years with all the logistic and care, I think it is not right for medical profession to undertake such procedure. At least as a part of teaching, yes, but not as a therapeutic measure.
So, Dr. Gupta, you've been practicing this field for about 25 years now, more than that, I think. 40 years now. So, can you brief us about the key challenges and issue being faced in the Indian aesthetic industry?
I did my board certification in 1977, so exactly 40 years of being a consultant plastic surgeon. The Indian aesthetic surgery market in particular and the aesthetic surgery market in general all over the world is facing a tough competition by several of unqualified doctors. Many of them are not even doctors, some of the beauticians, some of the people are dentists, some of the people are the general practitioners, etc. Because all these secrecy, people try to maintain secrecy, people try to hide that they underwent surgery, etc. And that is causing a big challenge. I strongly support, yes, patient got every right to get the best of the treatment. Patient got every right to get the alteration which he or she wants. But please get it done by a duly qualified and certified specialist who has got a good backing of experience. Same thing, like we are doing facelift, we are doing rhinoplasty, we are doing hair restoration surgery, we are doing tummy tuck, we are doing breast augmentation. If it is done by a duly qualified plastic surgeon and well-trained plastic surgeon, the complication rate is literally zero. I would say not more than 1 or 2%. And on the contrary, there are several cases and several reports where patients have undergone surgery with a other specialty and they run into serious complications and problems. And that is bringing down a bad name to the aesthetic surgery in general.
You won the Top Case Challenge Award twice on Docplexus. So can you share your views on these two cases in particular?
First thing, I want to thank the organization and the platform for nominating me twice for the Best Case Award. Let me share a secret of my life. I consider 4 VVIPs in my practice. First VVIP is my professional colleague. Always pay attention to their need and I don't charge them. Second VVIPs are people in public life, which could be policemen, which could be IT men, could be politicians, those who are doing something to the public life. And third VVIP are, of course, these poor patients, which I take care of them. And fourth, which is my academic VVIP, are my surgical challenges. And I go out of the way to make sure, like the 2 patients which I wanted to share. One was that acid burn girl. That girl, when she came to me, she was literally stinking like anything. She did not have a bath for 2 months or 3 months. Her hemoglobin was very low. There was a cross infection. She could hardly see from both the eyes, etc. And I took her immediately to the hospital, admitted her in Bombay Hospital. And there also, literally the entire ward, patients ran away. They said, we cannot stay. She was thinking, my resident have to make sure that they're given the bath, they gave her cloth, etc. So from that state, we did almost 70 surgeries on her. And every surgery would take about 3 to 5 hours of time. So devoting that much of time, surgical time, getting the entire team to work for 6 to 7 hours during operation and thereafter follow-up, etc. and the patient did not pay a single. All the money they made, the moment she was admitted with me, I made some phone calls to a couple of my NGOs, and they immediately sent me money directly to the hospital. And that is what is the beauty part. That is the beauty part of our society. Wherever there is a good cause, people are more than happy. And this patient also, appreciation for this patient for sustaining pain, sustaining the repeat surgery, because if somebody has to undergo surgery, there is a lot of trauma and tension. So for her to withstand the trauma and tension for several surgeries, prolonged surgery, post-anesthesia complications, recovery, and intensive care, etc. Finally, she got married. I think that's something which can be the positive side of the plastic surgery. The second patient, which I have also shared, is a distinction two aspect. This is, I still hold a world record of doing maximum number of major surgical procedures on one patient. That's 7. The other world record is only 5. So, second thing, this patient was brought to me in a very bad condition. He had condition like gas gangrene. He had a condition like his hemoglobin was only 2 or 3 grams. His other parameters were very high and toxic. And there were other members of the team of doctors who were working with me, including senior doctor like Dr. Falke and Dr. Dholakia. Unfortunately, both of them are no more. They had commented, probably they are seeing the patient when they used to come to an OT or ward, they say probably we are seeing for the last time. They would repeatedly ask me, Ashok, what would you do? How would you progress? But then you first look at the theme of saving life. Once you have reached that, you have gone that aspect, then you look at the theme of how to make the quality of life better. Third is how to restore function. And finally, restore of confidence. So it is step by step. It cannot be that you cannot do at the time when he is fighting for his life, that you do whether he is looking beautiful, whether he is looking handsome. So there are several cases like this. As a plastic surgeon working at a 2 major teaching hospital at Grand Medical College and Bombay Hospital, we had plenty of problem cases. But these are the 2 cases which have really taught me so many things in life. And this also holds a world record that at a stretch I did 38 hours surgery on him. And 3 major surgeries was performed. So, in fact, at the end of the day, when I finished surgery, one of my the other surgical colleague asked me, "You must be crazy to operate for 38 hours without charging a penny, because this is a free ward patient." And I said, "Yes, I'm crazy. That's the reason, because I love my specialty and I love challenges, and that challenges have given me something which I cherish."
So we are really thankful to you for this service, and I'm sure all of your patients must be very thankful to you. Just one last question. So Docplexus is an online platform for doctors. So how do you think this can help doctors to gain knowledge and share knowledge?
This is a very good initiative. I must compliment. Doctors need 3 support. One is that the good work being done by doctors, and apart from medical side, there are several medical professionals, those who are helping society in terms of education, shelter, food. Even that aspect also should be highlighted. Because as I was taking, the prescription of medicine and performing surgery is only 8% of the total healthcare. So we should bring that aspect. So that is one thing which I will be very happy to interactive or a platform where these comments can be shared. Second part is the teaching. Unless we build up our good generation in future, and I can share this also. When I was in England, my teacher used to tell me, a good surgeon is not known by number of good surgeries is performed, but by number of good surgeons he has produced. So since then, it has been my motto and mission that all my resident and postgraduate, those who have worked with me so far, which is about numbering to 150, that they are totally trained in all type of complex surgeries. And one of the doctor who is practicing in Maharashtra, she shared with me one day she had a very complex surgery and she said she could not understand what is to be done. So it was middle of the night. She just closed her eyes for 2 minutes, thought what Dr. Ashok Gupta would have done in this situation, and she noted down those things, and then exactly did the same thing, and she called me next day morning. I said, yes, that's the correct way of doing it. He said, yes, that is what I thought of doing it. So I think it's very, very important for training. And third, which I said, we cannot build a good society of medical doctors unless we help them with good teaching. So a pool of educational material in terms of archives, in terms of progress and webinar, etc., will be a long way of going, helping the medical education. Thank you.
Thank you so much, sir, for sharing your wisdom with us. We'll definitely take all these points into consideration. Thank you once again.
Thank you very much. Thank you.
To stay updated on our latest KOL videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!